am Dr. Talwar, a cosmetic surgeon from New Delhi, and today I will be speaking about the rhinoplasty. Rhinoplasty is actually the beautification of the nose, and this is usually done after the age of puberty. लोग यूजुअली पहले बच्चों को लेके आ जाते थे, 10-11 साल के बच्चे भी होते थे, एंड देन दे यूज्ड टू से whether the nose can be improved or not. But we feel that because once the growth of the nose is complete, so around the puberty time, after puberty 14-15 years, then we can do the rhinoplasty or the beautification of the nose. Now in rhinoplasty there are many techniques which are performed, or the many problems which can be solved. Like if you have got a hump on the nose, then naturally that can be corrected. We can shave it off and then fracture the nose from side and make it narrower. Not only narrower, and the height is also reduced. If your nose is flat, then we can raise the height of the nose. It can be done either by an implant, or you can take local tissues like cartilage from septum, ear or the chest, and with this the height of the nose can be raised. Then there is tip deformities. Tip deformities are as if your tip is height is less, or it is more roundish, then we can correct that much by trimming the lower alar cartilages. And if the nose is broad, then you can definitely narrow it down by cutting the extra tissue. So there are different problems in the nose which can be rectified by different techniques. The question patient asks is what will be the approach we will be doing, whether there will be any skin mark or not. So now there are two techniques. Either we take a cut inside the nose, by which and then go inside and correct the nose deformity. In that you don't find any scar. Another is now open approach, which is also getting more and more popular, and in that we just make a small cut in the columella and lift up the whole skin like a bonnet of the car, and correct whatever is to be done, and then put the skin back. So now this is open approach. So there are open and close, both the approaches are being followed, and scars are hardly visible. Now second thing, whether they ask whether it will be under local anesthesia or general anesthesia. So most of the cases are done under local anesthesia, in which we do not give you, don't make you unconscious. But yes, if the bone has to be reduced, or bone has to be cut or fractured and then narrowed, so then in that case we usually prefer general anesthesia, because patient might get slight pain. And after rhinoplasty, usually the dressing nose is packed for 2 days, and packing of the nose is removed, but the plaster or the tape is usually kept for 7 to 10 days time for total healing, till the time total healing occurs. And the results in certain cases are immediately, like if you raise the nose, it is immediately. But if you do the tip work, refine the tip, then the result will be apparent after 3 months onward, and the final shape may come after 9 to 12 months time. So you have to have patience when you go for rhinoplasty, and otherwise it is a one-day job. Morning we do, and if it is a local anesthesia, then patient goes home the same day. But if it is under general anesthesia, then by evening also we can send them back. So practically no admission, you can say, or maybe 8 to 12 hours admission is required, and dressing is required, as I said, for 7 to 10 days time. And the results are very rewarding in these cases. Male or female, both are coming forward for the nose surgery, because nose is one of the most prominent part of your face. Thank you very much.